So we're here today. We're going to be talking about the Slender Shot, which is a semaglutide shot. We're going to be offering it at the office. It can help patients lose weight by making one feel full. It helps keep the food in the stomach a little bit longer. So then we eat less.
So I guess my first question would be, Dr. Sameea, who's the best candidate for this, for the Slender Shot?
So the best candidate for the Slender Shot would be somebody who needs to lose maybe 10, 15, 20 pounds. We can titrate it. It's an injection once weekly. It's for people who maybe are not like obese. Obviously, it can be used for patients who fit that category as well. But in this office, it'll be mostly patients who are just trying to lose some weight, get a little head start, a little jump start to their fitness program.
That sounds really cool. So how would I have a consultation? What would my consultation look like with you? What would you ask me?
So, I mean, the consultation we can do either via Zoom or in person. So that those both are great options. We would definitely ask patients some questions to make sure they're great candidates. So one of them would be having any type of thyroid cancer or an endocrine neoplasia, which we would go over in the consultation. The patient should have had a physical exam, blood work, make sure that they don't have any diabetes. Again, this is for weight loss, not diabetes, even though the medication can be used to treat both. And also, we want to make sure the kidneys are working well.
Okay, that all sounds easy and doable. How soon after the first consultation could you get started?
So, if you're a good candidate, then we will order the medication, and you can get on it probably within 2 weeks. We will show you how to administer the shot in the office, and then you'll be able to do it at home. And it's a once weekly injection.
Oh, it's an injection. Does it hurt?
It's a really tiny needle. We do it in the subcutaneous layer. So it's a really small pinch, and most patients get used to it really fast.
Cool. How often would I come into the office?
So we would typically ask a patient to come in a few weeks before their medication runs out.
Okay.
And in the beginning, it's a titration. So the dosage will increase incrementally weekly. So the times that you would come into the office would change a little bit,
Okay.
but probably within like probably a couple months, 2 to 3 months after the first visit.
Okay, cool. So you're saying that my dose would change after each visit with you?
So to start on the medication, you'll be on a certain dose for a couple weeks,
Oh,
and then we'll titrate the medication up as tolerated because there are some side effects like nausea, vomiting, could be issues, GI side effects. So we will titrate the medication accordingly. Some patients do fine; they don't have the side effects. They can titrate a little faster. Others may need to take it a little bit slower.
hmm. And it sounds like this may be like a cycle. How long would I be on the shot? Is it something I would do forever?
No, so you wouldn't need to do it forever. So we would probably have a goal weight, BMI, and we would try to target that. And then once we've reached that goal, then we would titrate off the medication. Obviously, we want you to be on a good, healthy diet and an exercise plan. So those are things that need to be. You need to do those along with the medication.
Oh, cool. So I can still exercise while someone is taking the shot?
Yes, we definitely encourage exercise and a healthy diet. You'll also need to stay really hydrated because it suppresses appetite. It can also suppress the feeling of thirst. So we don't want patients to get dehydrated. So you need to drink lots of water and be very mindful of that.
That sounds really cool, really interesting. Is it safe?
It's a very safe medication. Again, it was um, first indicated for diabetics, and now it has an indication for weight loss. There are just GI side effects which can be limiting to some patients, and that's probably the most common reason for patients to stop the medication would be because of the GI side effects.
So you mentioned GI side effects. If I have any dietary restrictions, can I still take the shot? Like, what if I'm vegan or even if I'm lactose intolerant, could I still get the shot?
Yeah, I mean, you can still get the shot. Again, you have to see how your body reacts to it, but you have to also be mindful to eat a healthy diet. And some patients will feel a little tired, so you need to obviously make sure you have enough protein and calories so that do the things that you want to do.
Sounds great. If what if I'm a new mom and I'm looking to lose a little bit of weight? When is a safe time to start the shot?
So obviously, you don't want to be nursing if you're going to be taking the shot. And I would probably let your body kind of get back. So probably when your doctor clears you, your OB, depending on, if you're breastfeeding and how things are going, it can also sometimes affect a patient's mood. So there's, obviously postpartum depression. You want to make sure none of that is happening when you're going on the medication as well.
If I'm looking to get pregnant, should I start thinking about the shot or should I wait till after?
I think it's best to wait till afterwards because it hasn't really been tested in pregnant women as I don't know, maybe it has. But
What we say now.
I would say it's better to wait because you just never know any of the consequences that could happen, and it's really something that you don't want to take while you're pregnant.
Okay. What if I'm doing any other weight management programs? Like what if I'm cool sculpting, can I still get the slender shot if I'm doing something like cool sculpting?
Sure, you can still get the slender shot with cool sculpting. A lot of patients have already done a lot of treatments in the past, and they
Mm.
still need a little boost. So maybe you probably won't need to do both, but you can.
um, is this could the shot be addictive?
No, I mean, the shot is not it doesn't really have any addictive potential. And again, once you get to your goal weight, then we wean you off. So, I mean, there's usually not a problem with getting off the medication.
Okay, sounds great. And so you mentioned that it makes your body feel like you're already full. How does it do that?
So it works on a hormone, the GLP-1 hormone, and it works on the hypothalamus in your brain
Cool.
so there are signals for thirst and hunger. So it suppresses those signals, so you don't feel hungry, and also you don't feel thirsty. So you eat less food and take in less calories, and then you lose weight.